Hi, everyone. I'm Sunny Galt with the New Mommy Media Network. Thanks so much for joining us. This is a special Google Hangout on air that we have with Pregnancy Magazine. Today, we are talking about the Zika virus. You guys have probably seen a lot of this in the news recently. So I want to set the record straight when it comes to the Zika virus, what women here in the U.S. Need to know about the virus, especially if you happen to be traveling or perhaps you're planning to go on a baby moon or something like that. So here to help us set the record straight is our expert, Dr. Diana Ramos. She's an OBGYN. She's also the co-chair of the National Preconception Health and Healthcare Initiative. So, Dr. Ramos, thanks so much for being with us today.
Thanks, Sunny, for having me.
So the Zika virus, first of all, is this something that, just kind of came out of nowhere? Has it been around? I know we're hearing a lot about it now, but is it something that's new, and what is it exactly?
So the Zika virus has been around, but we're now hearing more about it because of the fact that there is an increased number of people who are infected, particularly in Brazil. The Zika virus started actually in Africa, and then it made it into some parts of Asia, the South Pacific in particular, okay, and now it's over in Brazil, and then that's where the whole Zika virus is spreading. The Zika virus is carried by mosquitoes, Aedes aegypti, and that's the mosquito that carries the Zika virus. But it's important to know also that this mosquito also carries dengue, chikungunya, as well as yellow fever, and so Zika. So the reason why we're hearing about this virus now is that in Brazil there was an apparent increase in microcephaly. So babies actually born with heads that are smaller, not well developed, and so there was an association or apparent association with that virus causing this microcephaly. So now we know that there was a study that was published a couple of weeks ago through the CDC that showed that there was a link in the moms who had been infected and they had a baby that had microcephaly, that the baby was shown to have Zika. So they're starting to see, yes, there truly is a correlation with Zika and microcephaly. So it doesn't stop there, though, okay, because now in Brazil, where they've had a larger number of cases, they're also noticing some neurologic deficits in the babies. So even though the babies were born, they're noticing, okay, there's some changes, developmental changes in the babies that perhaps were infected. The mom was infected with Zika when she was pregnant. So the mosquito is traveling in Latin America. The second highest country that has it is Colombia, and now we're seeing it in El Salvador, Mexico, Cancun, Bahamas. The list keeps growing. So the CDC is an outstanding resource, obviously, for the latest information on the Zika virus.
Right. And it's really scary because a lot of those are places that we here in the U.S. we vacation to. Maybe we had vacation plans planned even up to a year in advance, and suddenly all this information's coming out. And we're going, well, I want to protect myself. I want to protect my baby. So if a mom is bitten by one of these mosquitoes, what are some of the signs of infection? Like how would she know?
So first of all, it's important to realize that nobody in the U.S. has been infected by the bite of a mosquito. Okay, that's really important to keep in mind. And so the people who have been identified here in the U.S. to have the Zika virus have been people who have been traveling in the affected areas, and then they came back and they were then noted to have the symptoms, which are fever, maybe a rash, are the most common, malaise. They're just like flu-like symptoms. Some red eyes as well. So those are the typical symptoms. But it's important to realize that only about 20% of people infected manifest the infection. Okay, so you're not necessarily going to manifest that you had the infection if you're affected.
Okay. So how would you know? Would just time kind of tell? Or obviously try not to get pregnant if you're not pregnant. For how long? What is that if someone does get bitten by a mosquito and maybe they're showing some symptoms, you don't know 100%, how long do they wait before trying to conceive just to be safe?
So if somebody was vacationing down, say in Cancun or in Brazil, they were down there for Carnival, right? Mm-hmm. And now they came back and she's pregnant. So somebody like that, the CDC actually has a very good guidelines as to who should be tested So somebody like that is pregnant, recently pregnant, was in an affected area, then they need to see their healthcare provider and let them know that they were in the affected area. And depending upon whether or not they have symptoms, they will have a blood test done to see if the Zika virus is present. And if they don't have symptoms, they may, looking at the algorithm, may have an ultrasound later on in their second trimester to see the formation of the brain, the microcephaly or not, if it's present.
Okay. And does this have any kind of impact on future pregnancies if you've had the virus?
As far as we know right now, no. So if somebody has had the virus, they build immunity and they're done with it. And so they go on. It's like having a cold. You have a virus, you have that cold, you build immunity, and right, you go on. So typically that's the way viruses function. So as time goes on, we're learning more and more about the Zika virus. But for now, we know that, once they've recovered, they can get pregnant.
Okay. And what do you typically advise, or would you advise patients that came to you and said, hey, we do have this trip planned. Let's just say they're already pregnant because they're coming to see you. What advice do you give them as far as how to stay safe?
So if they're already pregnant, then I would say don't go. Because there's no need to expose yourself to any risk. We know that the most developmental risk occurs in the beginning, the first trimester, when everything is forming. But because we know that there could be some developmental issues later on when the baby is born, even though they may not have microcephaly, I would say there's no need to expose yourself to that. Go somewhere else. Go do your baby moon somewhere else and enjoy. So.
Okay. Well, Dr. Ramos, thanks so much for being with us today. We really appreciate it. And thanks for everyone for listening to our Hangout today and joining Dr. Ramos and I. Please check out our website at newmommymedia.com as well as pregnancy-magazine.com. We've got some great apps that you guys can download and get great content regarding pregnancy. We've got some great articles. You can subscribe to our newsletters, and everything takes you step by step throughout your pregnancy and gives you the best information we possibly can. So check out those resources, and we'll see you on the next Hangout.